everyone. My name is Sierra Foxwoods. I'm the program officer for the Upswing Fund for Adolescent Mental Health, and I'm really excited to be joined here today by Catherine Fox of the Fox Lab to share more about their project work for the Systems Enabler Grant that they were awarded last year. Their project is titled Leveraging Social Media to Enhance Access to Brief, Evidence-Based, and Low-Cost Mental Health Treatment for LGBTQ+ adolescents. With that, I will kick it over to Catherine Fox. Can you tell me a little bit about your work, your collaboration, and how this project that you've produced is really helping to increase access to care for LGBTQ youth?
Yeah, absolutely. Thank you so much for having me. So alongside Dr. Jessica Schleider at Stony Brook and several fantastic members of our team, we've been working to update and disseminate brief 30-minute interventions for youth. These interventions target mental health challenges like depression using a range of evidence-based principles. Unlike typical mental health interventions that can be expensive and require youth to see somebody in person, these are delivered directly to youth through their computer or their smartphones. The original versions of these interventions have now been completed by over 10,000 teens across the US. And we have strong evidence so far that these work at reducing things like hopelessness and depressive symptoms. However, with this specific collaboration, we recognize that these self-guided and accessible interventions might be particularly helpful when it comes to treatment of marginalized groups like LGBTQ and queer and trans youth of color, or QTPOC. And that's because these youth tend to face even more barriers to care that these interventions can help to overcome.
Wow, that's incredible that you've created this product that's accessible and it's self-guided. It sounds like a lot of really great thought went into this. Can you tell me a little bit more about the need that this specific solution addresses?
Yeah, absolutely. So in the United States and really across the globe, and I'm going to focus on the US here, we know that most youth with depression and mental health difficulties are never able to access treatment. This is because there's just so many barriers, things like stigma, costs, and long wait lists and limited access. The COVID-19 pandemic, we know, unfortunately, has exacerbated many of these barriers as well. So with this project, our work is really trying to disseminate evidence-based principles and interventions directly to youth to overcome a lot of the barriers that are typically in place that get in the way of youth accessing care.
Incredible. And I know you mentioned, getting this out to youth, but is there a specific population or youth that would benefit the most from these kinds of interventions?
Yeah, absolutely. It's impossible to overstate the degree to which the clinical psychology field in particular has left out the voices of minoritized folks and folks with lived experiences of mental health challenges. And so with this project, we were directly interviewing LGBTQ and QTPOC youth to update our existing interventions to make them much more accessible and relevant to these youth in particular. And so with their feedback, we've actually made a lot of updates, including a module educating youth about how minority stress can impact their mental health and to provide them with strategies to fight against discrimination, for example. And so what we're hoping, particularly with this project, is that we're going to be able to reach LGBTQ and QTPOC youth that have even more barriers to accessing care than their cisgender, heterosexual, and white peers, and also to provide them with care that's directly relevant to them.
Nice. I mean, it sounds like you did a lot of work making sure that youth who it's intended to serve are a part of the design process so that the information is not just relevant, but really engaging and speaks to their actual experience. That's really incredible. So I know growing up with social media and having all these like technology tools, communicating to my parents or even those around me was hard around like what it is and what I get from it. Is there anything caregivers or families should know about this intervention and how they can support adolescents in their life to use it effectively?
Yeah, absolutely. I think the biggest thing here that I would want to share with parents, guardians, and other caregivers is that this is an intervention that youth can access without their consent. And we know that sometimes when parents hear about this, it can sound really scary and even not safe for their children. So the first thing that I would want to say is that this has been tested again in over 10,000 teens. It's been shown to be safe and even effective for many youth at reducing mental health challenges. We also know that even though parents don't mean to, often guardians and caregivers actually get in the way from youth accessing care or give their children belief that they might not be able to support them in that moment. So what we're hoping here is that we're able to circumvent some of the barriers that parents and guardians accidentally put in place that prevent their kids from accessing treatment that they might need. I'd also want parents and guardians to know, though, that these are freely available and they can check them out online too. So if you find out that your youth is using it, you don't necessarily need to confront them directly about it. That might not be effective in the moment for a range of reasons. But if you want to make sure that you're comfortable with it, you could actually pop onto our website and check out these interventions yourself, just to feel a little bit safer for your kids.
Nice. So as a parent or a caregiver, they could kind of create an account. Does it work with accounts and then they create a profile and go through the intervention?
So to minimize barriers, we actually don't require people to create a profile. What we've learned is that often people are kind of turned off by the idea of needing one more account, one more profile, one more place to put an email address. This intervention does not require that at all. They could actually pop in, they'll be asked some questions about themselves. We'll definitely want to know that you're an adult, but that won't stop you from participating in the intervention. So we'll ask your age, and then you can choose the intervention that you want to complete, and you'd be able to guide yourself through it.
Oh, that's awesome. And great for me too, because that's one less password to remember.
Exactly.
So I know that you all have created these interventions. Can you share a little bit more about maybe your long-term vision or what the future looks like for scaling up these kinds of products?
Yeah, I think the biggest thing that I just want to say so that there's not a misconception is that we are not hoping to replace traditional forms of care. There will always be a need for one-on-one, in-person, a range of different kinds of treatment approaches. We are hoping to add to current treatment approaches, knowing that so many youth right now are not able to access care. So long-term, we're really hoping to be reaching thousands of youth, and particularly LGBTQ and QTPOC youth who are less likely to be able to access care than others, so that they're able to have some evidence-based principles to target their mental health challenges. And we're really passionate about getting these out to youth. We've already reached thousands, and we hope to reach thousands more over the next year.
That's so exciting. And can you share a little bit more about how you engage youth, or how do you come across these interventions? Are you recruiting them somehow?
Absolutely. So we're primarily recruiting youth via social media. So both Dr. Schleider and I have Instagram profiles for our labs where we advertise these interventions. And most recently, we've created a TikTok account that's officially live that you could check out, where again, you're able to learn a little bit more about these interventions and access links.
That's amazing. It sounds like you really thought through also, outreach and how you're reaching, underserved populations, queer and LGBTQ youth, and really thoughtfully removing any barriers to accessing them. Having them available for free is incredible. Do you foresee that this kind of intervention will be provided at no cost in the near future?
Absolutely. We plan for these interventions to be free forever. The highest cost is when we need to make updates to them. It does take personnel to be monitoring, et cetera, and there are adjuncts to these interventions that we'd love to be able to add. Things like that are not free. And at the same time, the 30-minute self-guided interventions are freely available right now, and we plan to keep it that way for the infinite future.
Nice. That's really exciting. Well, Catherine, thank you so much for your time. Is there anything else you'd like our network to know about these single session interventions, or where they can find more information?
Yeah, absolutely. So in terms of just where you can find out more, please feel free to reach out to me at catherine.box@du.edu. I'd be happy to share more information, for example, about our website, which is live, as well as our different social media profiles, if you'd like to check those out. And I'd also be happy to answer any questions you might have about the interventions themselves.
Awesome. Thanks so much, Catherine. Thanks for joining us, and we'll talk to you later.
Thanks, everyone, for your time.
All right. Bye.